disease. So GI will take me, GI disease, right? We're going to do disease and med. Normally, I don't do disease and med on the same day, but I'm doing it because yesterday we didn't do it. We got so caught up, all right? So here is the disease we're going to do. We're going to do Hep A, B, and C. We're going to do liver failure. We're going to do gallbladder, which is cholecystectomy, gallbladder. I'm going to go over in the book with you. We're going to do appendicitis. We're going to do peptic ulcer. We're going to do GERD. Right? So we're going to do this plus medication, this plus medication, this plus medication, this plus when I say medication, if it's surgery, that is considered, okay? So I want y'all to understand. Peptic ulcer, GERD, pancreatis, okay, plus meds. Something called IBS, Crohn's disease. It's called, I'm going to squeeze it here, IBD plus med. Any question? And of course, the diagnostic test, right? That's what our GI look like. And as you study it, you check off. True? Mm-hmm. Now, your calendar today should look like this. We're going to do GI first, and then we're going to do hygiene and safety, second part of class, because of yesterday. Any question? Now, listen. GI, don't go wood. Listen. No. I can tell when I need to say something over. I can tell by your face. And I'm pretty good. Sometimes when you don't understand, you want, that's what the tape is for. So I can tell when I need to say something in Creole, when I need to say it in English, when I need to say it again. Because your face tells me the confusion. All right? But don't go, recap on that. There's no possible way. Or you'll be here 10 months. Okay? Because the class is big. We'll be here a year. So bear with me. I'm going to say everything twice. Twice. If you don't understand something, when you get home, you stop, recap on your tape. That's the purpose of why you tape it. Capiche? Stick with me, because we're going to do drugs and disease. So you're going to jump. So take your paper, your book, what for medication like this, and then we're going to go to the disease. Right? And you're going to fold the same way. Now, commencez from back to front. So now we will start from back to front. So si we dit back to front. Now commencez there, you not monter. So that means now commencez on page 604. Have A, have B, and C. The next page I'm going to go into is pancreatis. Then I'm going to go to gallbladder, which is cholecystictis, and the liver cirrhosis. I'll direct you. Don't go, what, trying to ask your friend. Stay with me. You got it? Okay. All right. So starting on page 604, there's 3 Hep A, B, C. That's all you need to know. Hep A, Hep B, Hep C. First of all, how do we know you have Hep A, Hep B, Hep C, blood? Okay? Blood. Now, the first hepatitis is A. We're going to talk about it. Hep A, I'm on page 604, highlighted. So if I stand him the Hep A, we're going to Hep A for the leave, right? Good morning. Hep A is treatable, it's curable. Hep A. Hep B, Hep C is treatable but not curable. Again, Hep A is treatable and curable. Hep B and C is treatable, not curable. Miss Sonia, let's talk about Hep A. I'm on page 604, highlighted. Hep A, another name for it, Nclex they Hep A, no? They put Infectionist Hepatitis. They put Infectionist Hepatitis. Hep A, you normally get it a certain time of the year. Fall and early winter. Now, who normally get Hep A? Children and people who work with poop. Plumbers, right? And also, you can get it from eating raw food, shellfish. So another group of people that get it, restaurant workers. So again, children get it because when they are potty training, they touch their poop. Plumbers, because they work with the toilet, right? Restaurant workers or people who eat raw food, shellfish, get it. You got it? So, Hep A, which another name for it, Infectionist Hepatitis, normally seen in children. Individual institutionalized, like people who work in jails, jailbirds, Hep A, B, C, jailbirds, people who live, 50 million people live in a house. You can get it through drug too, right? But mostly this has to do with poop. Now, let's go. Transmission, fecal to oral route, person-to-person contact, perinatal, which IV, contaminated fruits, vegetables, uncooked shellfish, Nclex question. Contaminated water or milk, poorly washed utensils. Now, ready? Prevention. Prevention. Strict hand washing to prevent it. Stool and needle precaution. Treatment, municipal water supplies. Right here. The vaccine they give you, it's called Havrax. Havrax. That's an Nclex question. The Havrax, the vaccine, is given IM. Hep A, go vaccine. Now, Hep A, once you have it, it's treatable, it's curable. Now, here's the Nclex question. You remember I told you, Hep B, Hep C, you have it. There's treatment, but there's no cure. There's somewhere you're going. You're going to liver failure. Hep A, because it's treatable, it's curable, by again, liver failure. Hep B, Hep C, anytime the patient have it, you will see jaundice. That means the liver, no good. Who's the highest group of people with Hep B? Patient. It's in the book. ICN. And I'm going to tell you why. Because in the 60s, the 70s, vaccine was not all that. They have some, but it wasn't all that big in Haiti. Yes, it's in the book. Yes, it's in the book. Now, Hep B, students say, Miss Sonia, what about the vaccine you get from Hep B? As a nursing student, you all have to go get a Hep B vaccine. The purpose of the Hep B vaccine, if I come in contact with it, my body is immune from it because I got the vaccine. But once you have it, that vaccine don't do nothing for you. Where would you live here 10 years, 15 to 20 years? You live fine. The only where you going to go, liver failure. Hep B, Hep C give you liver failure. Natalie Cole, she did cocaine, heroin in the 60s. She just got a liver transplant. Once you got Hep B, Hep C, you go on one way, and that liver cirrhosis, which is another name, liver failure. There's no cure for B, there's no cure for C. Now on television, there's a new vaccine for C, but they don't know if it works yet. Once a year, you go get your HIV test. You need a consent for that. And you also need a consent to do Hep B, Hep C. A lot of people say, well, I got pap smear, everything's good. What happened to HIV? What happened to Hep B, Hep C? Say some. How do you know you got Hep B, Hep C? Blood. Any question? Did y'all hear what I said? 3 hepatitis you need to know. Hep A, Hep B, Hep C. Hep A is treatable, it's curable. Hep B, Hep C, there's no cure. Now, how did you get Hep B? Blood, like sex. How did you get Hep C? A lot of time has to do with tattoos, needle exchange. Pamela Anderson have Hep C. That's why as nurses, we do needle exchange. You do cocaine, you do heroin, you give me the dirty needle, I give you a clean needle. Or you give them a bottle of bleach. Adult will do drugs anyways. So you don't tell them, stop doing drugs. No, you just do, okay, give me the dirty needle, I'll give you a clean needle. The child having sex, you beat them to death? No, you teach them about condoms, you take them, you put them on birth control, and you, yes, what you gonna do? Put them in the cake, did they put them in the cake? Right? Sometimes we so, ooh, for nothing. For what? Children for sex. Oh, well, you tighten up, they have sex, what do? You pray about it, and you take them to health department. Pas tout le monde bon, you qui va bon, et va vrai. Ah, no. No. Sneaky. Tout le monde you qui va bon. Tu te mets tout fouillé. Et you really swag.
One way or another, they have
All right, any question? Hep A, B, C, yes. Yes.
C for with IV drug use, right?
Not C, not only with IV use. You can get it through sex too, but 99.9 is IV use. C, yes.
Which one is making problem with the liver failure?
All of B and C. No, guys, come on. No A. You know why A don't hit the liver? Because A is treatable and curable. And A, you always ask the patient, have you traveled out of the country? Okay? Florida asks the shellfish. I'm telling you, you know the shellfish. Florida don't put Hep A, they put Infectionist Hepatitis. You must know they talk about Hep A. Any question? All right. So that means we did Hep A, Hep B, Hep C. Remember, I don't hear nobody say, is there a medication for Hep B and C?
No, because there's
no treatment. You go into liver failure. When you get to the liver failure, that's when they give you medication. Yes.
Everything
No, all the tests are the same material. Heart failure is heart failure. Hawaii, Florida. However, Florida, you need to miss 20. If I sick, Hawaii, you can miss 40, 35 and still pass. The scoring is different, but the material is the same. All right? Hepatitis C, you get it through sex or tattoos. It will lead you to liver failure. Another name for liver failure is liver cirrhosis. Yes. Yes. Yeah, of course. Anything IV, blood transfusion, and also dialysis. Dialysis. My friend mom died from blood transfusion back in 1986. Her last son, they gave her, remember they didn't used to screen the blood as good. And she died of liver failure in like 2000, I think 2008. So she lived with it for a while. All right? Now, then we're going to go into pancreatitis. I'm on page 602. Pancreatitis. So as I do the disease, I check off. You see? And that's the same way you're going to do it. Right? Every system I do, I list the disease. Now I am on pancreatitis. I am on page 602, pancreatitis. Pancreatitis is chronic inflammation of the pancreas. Now, I don't want the students to focus a lot on acute and chronic, but I want you to focus more on the word pancreatitis. Acute means you woke up one day, you have it. Chronic means you drank for a long time, and now you have pancreatitis. Now, go to 4. Number 4. Number 4, everybody see it? Precipitating factors. That means what caused pancreatitis? All that apply. Ready? Trauma, alcohol, biliary tract disease, viral bacterial disease, fat, high cholesterol, cholecystitis, number 4, page 602, hyperparathyroidism, ischemia vascular disease, and peptic ulcer, which I'm going to talk about. When you have pancreatitis, I don't care if it's acute or I don't care if it's chronic. There's certain symptoms you will see in the patient. Ready? Here's the symptoms. Stomach pain, sudden or at the mid-epigastric or left upper quadrant. The patient tell you it's radiating to their back. Pain that is aggravated by a fatty meal or alcohol. Nclex question. The patient tell you, c'est l'aime manger graisse, m'gen douleur, ou l'aime boire un petit alcool, m'gen douleur. You know that has to do with pancreas. English, if the patient say, I have pain when I drink, or if the patient say, I have pain when I eat fatty meal, you know that is something to do with pancreatitis. Now you're going to say, where is this pain radiating? If the patient say back, you know it's pancreatitis. Now, if I'm having chest pain and I tell you it's radiating to my shoulder, what is that called? Angina.
Angina. MI to the arm.
Left arm. MI. We can't go take nobody tests. They don't know those. Okay, let's continue. Okay, now, nausea and vomiting, weight loss. Everybody have nausea and vomiting. Everybody have weight loss. Now I want to know if you have pancreatitis. There's something I'm going to see in the patient. The first thing I'm going to look where the belly button is. I'm going to see a discoloration. Discoloration means it can move, it can fat, it can pink, a discoloration. It can be blue. That is called the Cullen sign. Turner sign, you're going to take the patient, you're going to lift their back right here. You're going to see blue. That is called Turner sign. So the two assessments that's associated with pancreatitis is Cullen sign and Turner sign. Here's where Nclex get you. Two students, you'll think Cullen sign say blue. No, Miss Sonia didn't say that. They say discoloration. So it'll be any color in the rainbow. The Turner sign is blue. So Nclex put color sign black, student love line. Yes. Purple. Yes. Green. Yes. Flame blue. That is called Turner sign.
When you look at somebody's color, or somebody that's very dark, can you see those signs too?
No. African American, you will not see the color, but you will surely see the flank. Because the Turner, because African American, it will not be blue, to be black. Collins, anytime somebody has pancreatitis, black people, you know how you know it's pancreatitis? Because they're going to say, when I eat fatty food, it hurts. And when you take off the shirt here, I say, oh, noir, noir. What way, noir? It's black, but it's a bit spot. Oh, light skin, you'll see blue. Light skin, you'll see perfect. But black people, it's more of assessment. Like they'll say, it radiates to my back. Oh my God. Sharp pain. Hey, pancreatitis. Any question?
Miss Sonia,
Yes.
what about the amount of alcohol? Is it throughout amount, or is it like you just start taking alcohol?
No, more chronic use.
Okay.
You see Jim, what's that guy named Apple guy? Job? Okay, years. Patrick Swayze, years. You know, let me give you a story. About 2 years ago, my brother who lives in Fort Lauderdale came here. Oh, I don't feel good. He went to JFK. My brother plays soccer, but he drinks. He's not a heavy drinker, but he drinks. So when the doctor came, I didn't know it was pancreatitis, but when the doctor came, the first thing he did, gave my brother a paper to an alcohol place. My brother got mad. Oh, sa blanc sa dit, son John qui me tell the truth. You drink, and the doctor think it's pancreatic. What is that? I said, people who drink. He said, how do you know I drink? I said, because you're the sign and symptom. Stomach hurt, backache. I didn't see the Turner sign on him, but he had all the symptoms. First thing the guy did, gave him a pamphlet to an alcohol place. And he got offended. Now the job gonna think I'm an alcoholic. I said, well, you do drink. You see that? Right away. By what the patient say, you already know. Nurses, remember, we don't diagnose patients. That's not your job. But you will have an idea what's wrong with the patient. All right? So, when we have pancreatitis, right, the nursing intervention. Yes. Yes, ma'am. Intervention. Number 2. I'm on number 2. So I told you what is the disease. I told you risk factors that can cause it. Right? So what is the nursing intervention? Ready? Let's go. Number 2. A. Instruct the client on prescribed diet. Fat and protein intake must be limited. no glass. So now Nclex can ask you, watch, the patient have pancreatitis. Which diet? Now, the question is not about pancreatitis. The question is about the diet. So where did I teach you the diet? Fundamental nutrition. So the patient will need to be on low fat and low protein. Okay? Now, instruct the client to avoid heavy meals. Instruct the client about the importance of avoiding alcohol. Boy, my God. Anytime you're diagnosed with pancreatitis, you don't cut down the alcohol. You stop the alcohol. If not, you're going to have pancreatic cancer like Patrick Swayze, the guy that played on Ghosts. That's what he died from. Ready? Provide supplement of nutrition, vitamins. Administer pancreatic enzymes. I'm on page 603, pancreatitis, number 2. 2 intervention. You got it? Show her 2. Lena, you okay? 2 intervention. You with me? Who's not with me? Raise your hand.
Thank you. He showed.
You, everybody with me? Okay, you remember, we going from back to front. Stay with me. All right? Keep up. 603, number 2.
Miss Sonia,
Yes.
my recording is full, so I'm recording with my phone.
On your what?
With my phone.
Okay.
My recorder is full.
Shh. Guys, that's little 603, number 2. I'm going to get to something very important. You remember yesterday I did cystic fibrosis. And I told you we're going to give this patient an enzyme. What did I tell you that enzyme is called? Pancreatic enzyme. But the name of it is called Pancreas. And you take it every meal? This patient gonna take Pancreas every meal? So what is the drug for pancreatitis? Multivitamins and also Pancreas. Right? Administer insulin. Why? Why? Why would the patient who had, hold on, slow down, so it can, because our motto this year is about comprendre. Why one person, you gonna do it, Lena? Lena. Why will this patient be on insulin or metformin?
Because your pancreas, it secretes insulin, so you're getting rid of the insulin when it's not there, so you need to replace it.
That's right, because this patient will mimic
Diabetes.
although they're not diabetics. So Nclex asks you, on the patient who has pancreatitis, which order you will see their order? Insulin, sugar check, and the doctor can order insulin or metformin, because débutant des problèmes à pancreas, the patient will mimic diabetes. Any question? Comprendre. So Nclex RN, you mix it, you add it up, break it down, you still understand. And let me explain something to you. Let's level 3. Why would this patient be on potassium? When you give them
Insulin, it lowers your potassium.
Potassium. Good job. So I can ask any question on pancreatitis. You know what it is. You know who gets it. You know signs and symptoms. You know medication. You know any other. Can I ask you a question? Can they give you an EKG here?
Yes.
Because of the what?
The potassium.
Because of the insulin and the potassium have nothing to do with the disease. You got it?
Yeah.
You feel the license coming?
Yeah.
By the door.
Instruct the client, look at age. Instruct the client on the treatment plan for glucose. You see that? Miss Sonia already told you. Instruct the client to notify the physician if increased arterial occurs or if abdomen distension or cramping. Yes, if you stop alcohol, you exercise, you taking pancreatic enzyme, right? You're doing all of that, but the stomach still big. That's a medical emergency. So here's the NCLEX question. What did the patient tell you needs you to call the doctor? I have pancreatitis, although I'm taking my medication, my stomach is still, that's a medical emergency. Any question? I told you what is the disease. I told you who gets it. I told you signs and symptoms. I told you medication, right? I told you diet, right? Let me ask you a question. What about eating? Can the patient eat and go lie down? No. They need to eat, sit up. They can ask you a question on position. Any question? So I go to my board, I put a check. Yes.
It's only on the stomach and soil that's on the
Non, après tout ça le fait au patient, va transpirer pour something worse. Okay? Check. That's how I want you to study. Just like this. Listen, we're going to say this in English. If you do this and you still fail my test, change your career. No, if you read it, what I mean, don't listen to the tape. Listen to the tape and read it and check everything, and you still don't understand, something wrong. No, don't laugh. Yes, question. Who has a question? Somebody asked a question. Yes, mommy. Someone had a question. Okay, all right. Uh-huh. No, not maybe. Okay. All right. Then we go into gallbladder. You're going to go to 601. You're going to see a little man. His name is Ricky. But we're not talking about Ricky. We're talking about cholecystitis, which is gallbladder. Everybody put gallbladder. You're going to find Ricky, 601. 601. Il va parler de messieurs, non? En bas, messieurs. On va prendre un bagage de cholecystitis. Tout le monde met des cholecystitis, c'est gallbladder. Cholecystitis, c'est gallbladder. Itis means inflammation. So, cholecystitis is inflammation of the gallbladder. Listen, gallbladder is the only little piece of the GI. If it's not there, you could live. You really don't need it, but you don't want nobody to take it from you, right? Gallbladder, let's talk about it, right? Inflammation of the gallbladder that may occur acute or chronic. Acute inflammation associated with gallstones. Chronic result inefficient bowel emptying. Make sure you know that. That's a popular question. If they ask you to differentiate between acute and chronic. Acute or chronic. Okay? Now, data collection. That means moun ki gen gallbladder, me sign and symptoms. Moun na presente devant. These are the things the patient complaining of. Ready? Nausea and vomiting. But remember, Miss Sonia said everybody got nausea and vomiting. So you cannot say that's what it is yet. So he come to the ER, I have nausea and vomiting, okay, I'm still assessing. I have indigestion, gas, okay, we still checking. I have belching, okay, we still checking. Flatulence, okay. Let me ask you a question. Nausea and vomiting, do I isolate him? Yes.
NPO.
Yes. I isolate him and I NPO him. You feel it? I don't know what's wrong with him yet, but I hear vomiting and I RN. You will NPO him, you isolate him. You don't know what's wrong with him yet. Now, continuing. He have the pain. Then you gonna ask the man, where's the pain radiating? To the scapula. Hey, okay. You remember earlier when we did pancreatis? Where's the pain radiating?
To the back.
That is what you must know. The different assessment. Douleur, where's the douleur radiating back? You cannot call that gallbladder. Radiating to the scapula, c'est mon boule ça. Right there. You see, hey, that sound like gallbladder. But you don't know yet. It may. Now, there's something you do that's going to tell you it's gallbladder. Here it is. I'm going to take my hand and I'm going to pass under his breast. Women, we say breast. Men, just his little boob line. Who go, et puis la fait, that is called Murphy's sign. Murphy's sign. Again, pancreatis have pain. Gallbladder have pain. Pancreatis, they're going to tell you the pain radiating to the back. Cholecystitis, they're going to tell you pain radiating to the scapula. Now, pancreatis, there's two assessments. Cullen sign, Turner sign. Cholecystitis, there's one assessment, and it's called Murphy's sign. The problem with the students when it comes to GI, you don't know what assessment go with what. Cholecystitis, Murphy sign. Pancreatis, Cullen sign,
And
Turner
Turner
sign. Where's the pain? Cholecystitis, scapula. Where's the pain? The back for pancreatitis. Because both has nausea and vomiting. Okay? Yes.
Okay, when a patient has, like, maybe a burn, they do have cooling sign as well.
A what?
A burn.
A burn?
Mm-hmm.
They have what sign?
Cooling sign, when they have GI problem, like when they have burn, 75% something burn or something.
No, they have peptic ulcer. When you have, it depends where the burn. When you have burn, look, when you have burn upper, what happened is the inflammation eat the lining of your stomach. That is why anytime you burn in the face, one of the medication they give you is protonics, because you automatically have peptic ulcer, which I'm going to talk about that when I get to peptic ulcer. Not Cullen sign. Cullen sign and Turner sign is associated with the pancreas. Yes, but when you burn nafigi, because the inflammation mange well and acid, and that's why the patient have peptic ulcer, which we'll talk about when we get to peptic ulcer. All right, now, ready? Pain, localized right upper quadrant. The pain is right upper quadrant, but it radiates to the scapula, right? Elevated temperature, yes, anytime you have gallbladder, you also going to get fever. Your tachycardia, you are dehydration, yes. Now, if the gallbladder has to do with the biliary part, you will have jaundice. Dark orange and foamy urine, stertortia and itching. Gallbladder, if it has to do with the biliary part of it, you see the patient itch. Got it. Turn, itch. Now, ready? D, 602D. Everybody with me. So I told you, what is cholecystitis? I told you the sign and symptoms, right? Now, we're going to talk about the interventions they do. Sometimes they can lower the inflammation, and that's it, and sometimes they will remove it. So I'm going to give you both. Let's do intervention without doing surgery yet. Intervention. Ready? I will NPO you, right? They will put an NG2. That is when you must know how to put the NG2, which you learn in skills, climb with the tool. You're going to get your book and know how to put an NG2 in. Anytime you come in, gallbladder, NPO, NG2, NG2 pour lavage, decompress, right? Continuing. Administer antiemetics. For what? Antiemetics is for nausea and vomiting. They will give medication to relieve the pain. Now look, note, although morphine sulfate may be prescribed, they're generally avoided because of the artery that can cause spasm. That's an NCLEX question. And let me explain to you guys. Anytime we have GI problem, pancreatis, diverticulitis, anything, morphine was not a drug of choice. They'll give you a little Tylenol, they'll give you a little Demerol, but morphine, anytime you have GI problem, no morphine. On this side for NCLEX. It's right here. Right here, stay with me, page 602. They will give anticholinergic and antispasmodic drug, which is called Bentyl. Bentyl. B-E-N-T-Y-L. B, diclomycin. Bentyl. And I'll show you where this drug at when I go to the drugs. Bentyl. Bentyl. This is called antispasmodic. Spasmodic spasm. Ouais, ventre là bon petit tranché. C'est pas douleur. Douleur c'est une, tranché c'est l'autre. Tranché ouais, ventre là. Cramping. You give antispasmodic. For pain, douleur, ya bay moun ti Demerol. Any question? Okay. Huh? Yes, Demerol. Morphine. Let me tell you, see, old doctors, they old. They will not give morphine. New doctors, they will. But you don't, and the nurse supposed to question that.
They gave my mom morphine and she was just diagnosed with colitis. She was in the hospital.
Ulcerative colitis?
Yes.
And I'm going to talk about that. Ulcerative colitis, GI, right? But let me ask you a question. Shh. Is it ulcerative colitis or she have Crohn's?
It was ulcerative colitis.
So IBD, she was bleeding too?
Yes.
That's a different disease, and I'm going to talk about that. Inflammatory bowel disease. There's two, Crohn's and ulcerative colitis, and I'm going to talk about that. Yes? No. Demerol is for pain. Bentil is for spasm. Spasm c'est clenché. Pain c'est douleur. Demerol is for pain. They can have morphine c'est pour pain. Demerol c'est pour pain. But enfant yo they morphine. La pain Demerol. And Bentil là c'est pour clencher, spasm. Okay? Huh? No, it's right here. Stay with me. Number 4. Go to number 4, 602. Right? Go to the reason y'all asking these questions, y'all not reading the book with me. I need y'all to read the book with me. You see, look, Mama, 602-4. Like this 602 number 4. When? Got it's in parentheses about the morphine. You can't believe, but it causes more problem. So for you, NCLEX, what I want you to know, always question that. Anytime a patient have GI problem, question morphine. Okay? All right? Now, instruct the client to eat small, low-fat meal. Highlight that, because I'm going to come back to that. When you have gallbladder inflammation, what causes it is because you eat fatty food. So when you have it, we want it to go down. We're going to tell you to cut back on the food, fatty food. However, when you do surgery, I remove the gallbladder, and I'm going to talk about that. The surgery is called cholecystectomy. I remove the gallbladder. The first food I'm going to give you is a fatty food because I want to know, was the gallbladder really removed? Again, once you have inflammation of the gallbladder, enflé, mabzou, calmer, manger graisse. Okay. Now, the medication we give you don't work. So doctor a fait surgery, excirer gallbladder. Remove it. I want to know if the surgery worked. So after removal of a gallbladder, the first thing I'm going to do, I'm going to give you fatty meal. Any question? Don't get it confused. Okay? I'm going to give you fatty meal after the surgery pour me garder si surgery a travail. Because if you eat the fatty meal and I see the fat in your poo-poo, that means the surgery worked. Look, wait till I get to cholecystectomy. Hold on. Yes.
After a surgery, they can continue eating normal or continue with
No, you still want the patient to low fat. Low fat. Yes.
That's the first thing they need after
A fatty meal. A big steak. A big steak. Just to see if, guys, the purpose of that. See, that's what I said. When you have the disease, we put you low fat. Because we're trying to, it's inflammation, so we're trying to get the inflame to go down. But if everything we give you, the inflame don't go down, we're going to do surgery. And that is a cholecystectomy. I remove it. I want to know, did the surgery work? The only thing I can do is give you high fat. In the stool, I see fat, which is called stertia. That tell me the surgery worked. Right? Yes. No. Hold on. Anytime after any surgery, vous commencez avec Pancreatis. But ça, vous avez besoin de mettre si ça travaille. Okay? They want to know if it works. Right? All right. So, continuing. Instruct the client to avoid gassy, foamy food. Now we're going to prepare the client for surgical procedures. Now listen. So we did all of that. Your information didn't go down. Okay, Cowwater, we're going to do surgery. Cowwater, come in. What is that surgery called? Cholecystectomy. We're going to prepare the patient for surgery. Now, monitor after surgery. Monitor for respiratory. Complication caused by pain and incision. Encourage coughing and deep breathing, which you learned that in fundamental pre-op, post-op. Instruct the client about splitting an incision. Where you learned that? Pre-op, post-op. Administer antiemetics, right? There you go. Maintain NPO and NG2. There you go, mommy. Advanced diet. Advanced diet. What keeps you on the from clear to solids. You got it? Now, the advanced diet to solid is grease. Give them a greasy meal. Here it is. Anytime you have a cholecystectomy, there's two tubes that's going to go in you. NG tube and a tube called T tube. Again, anytime you get a cholecystectomy, Miss Sonia already proved to you guys why they put the NG tube. The T tube, mainly T tube, no green box, RN. It's the problem students, you don't know that T tube go with gallbladder. Everybody say it. T2 gallbladder. T2 gallbladder. T2 gallbladder. What's another name for gallbladder? Cholecystitis. Let's remove it. Cholecystectomy. Anytime I get a cholecystectomy, they put NG2 and they put T2. Let's talk about the T2. T2 is placed after the surgical exploration of the common bowel duct. The tube preserves patency of the duct and ensures drainage of the bowel. Right? Now, intervention, RN. There you go. There go your question. Position the client semi-fowler to facilitate drainage. You see, I'm in the green box. Now, monitor amount, color, consistency, and odor. Let me tell you something. How much drainage? You need to see 300 is good, 350 is good, 400 is good, 450 is good. Anytime you see 500 and up, medical. You see? 500 and up, medical emergency. Report sudden increase of bowel to the physician. Monitor for inflammation and protect the skin from irritation. Keep the drainage below the level of the gallbladder. Monitor for foul odor, prulet, drainage, and report the presence to the physician. Avoid irrigation. Hey, this tube looks like a Foley, but it's cuter than a Foley because it's collecting bowel. You don't irrigate without an order. You don't clamp it and you don't milk it. Milk vledi etile glass. You don't do that. Everything has to have an order. Okay? From the it's in the order sheet. Now, avoid irrigation, aspiration, clamping of the tube without the doctor's order. If you got an order to clamp the tube, if you get it, NCLEX asks you, when do you clamp it? Ready? Prescribe the clamp the tube before a meal and observe for abdomen discomfort and distension. Nausea, chills, or fever, unclamp the tube if nausea or vomiting occur. So T-tube is associated with what?
Gallbladder.
Give me the name, the profession name for gallbladder.
Cholecystitis.
What is the surgery? What drug we give for the spasm? What drug we give? Demerol or any. Can they give morphine? No. Okay. Yes, but it's not questioning. Any question? After the meal, after the surgery, what meal they gonna give? Before the surgery, what teaching you gonna teach the patient? Who can go to Pearson? They ask you a question.
Right here.
Who can go take an exit test at school? Cholecystectomy, cholecystitis, Pancreatis, Hep A, Hep B, Hep C. We cool? Now, so I ask you a question on the Hep A, B, C. What are you gonna say? Med surg. I ask you a question on pancreatis. What you gonna say?
Med surg.
I ask you a question on gallbladder. What you gonna say?
Med surg.
I ask you a question on T-tube. What you gonna say?
No, fundamental.
Gallbladder. Med surg. You see how easy the license is? Don't you feel it? Yeah, I feel it. It's so easy. Down. Let's go. Break this stuff down. Guys, this is the opportunity for you to make $100,000 a year. That's it. You read the book, you pay. What's wrong with y'all? Yeah, stop it.
Yes.
All you gotta tell me, give me a damn book, put me in a room, I'm gonna go in.
Indeed.
You gotta be hungry.
Yes. Trust me.
Jesus, we're island people. Liver cirrhosis. Liver cirrhosis. Right? I told you my student called me, right? I'm going to get to the lecture. She called me. She's an LPN. Miss Sonia, I got 2 checks. She called me last week. I said, how much one? $2,800. I said, how much the other one? She says $1,480. How much? 2 checks. She worked 2 jobs. She's an LPN. And I said, 2 jobs? What time? She said, oh, let me tell you, I worked 3 12-hour shifts somewhere. And then the other one, she worked a couple of days. So she had 2 checks. I said, is that after tax? She said, oh, Miss Sonia, that's after tax. I said, so what you gonna do? I don't know. I said, you owe Miss Sonia money? Oh, no. I said, well, bring the check to Miss Sonia. Oh, Miss Sonia, I don't know. Guys, look, she got 2 damn jobs. LPN. One, she made 30-something driving. She said, I bought me a stupid little car and a GPS. I get paid.
That's what I would do. I would be trying to help people.
Okay, call me. Leave me the hell alone. You could have paid.
I want to.
Why you bothering Miss Sonia? If you ain't bringing the money to Miss Sonia, don't call me. Liver failure. Liver failure. Come on, we were doing good. Ricky, ugly little Ricky. Say hi, Ricky. Ricky is the man. Ricky is the man. Ricky had liver cirrhosis, and we're going to start on Ricky on page 600B. 600B, it's a complication. It has a diamond right here. Another name for liver is called portal. So the people you see portal, they're talking about liver. Portal. Now, anytime you have what we call liver cirrhosis, It's the same thing as liver failure. That means liver no good. Now, there's a boyfriend and girlfriend going on in the body, and it's liver and kidney. They go together. Liver, anytime liver go bad, the kidney go bad. And that is called hepatorenal syndrome, because the liver make the kidney go bad. Again, when the liver go bad, liver won't see madame, the wife or girlfriend named kidney, is kidney. Anytime the liver go bad, kidney go bad. And it's called hepatorenal syndrome. And I'll show you where that is. Now, I'll show you where that is. Calm down. It's in where Ricky body is, where it says renal findings. It's called hepatorenal syndrome. Yes, it is. It is. Go to Ricky body, where it says renal, where it says hepatorenal syndrome. I want you to understand the reason the kidney pas bon, c'est liver fait kidney pas bon. You got it? Okay. Now, so we back 600 complication. When the liver no good. But first of all, guys, let's take a job of a liver. Because for you to, what liver help with what? Break
down the protein.
protein. Liver help with sugar. Liver metabolize drugs. Okay? Right? Liver works with A, D, E, and K. Liver also help with bleeding. Make sure you know the job of a liver. Right? So you have to know. So when the liver no good, all of these things is compromised. True? Liver job be break protein. Help with sugar. Not only the pancreas help with sugar, y'all know that. That's the cousin of the pancreas is the liver. See, everybody got a little family thing going. A, D, E, K, and bleeding. Okay, so let's go. When the liver is no good, right? Cirrhosis. What's the number one cause the liver no good? Alcohol, Hep B, Hep C. So the liver no good. The liver builds a pressure, a high blood pressure in the liver, which is called portal hypertension. Meaning the patient have a high blood pressure throughout the body because liver are no good. Now, this hypertension in the body causes the arteries to expand. The arteries is around the esophageal, and the pressure causes the patient to spit out blood from here to the wall, and it's called esophageal varices. Again, when you have liver cirrhosis, the liver builds up a pressure. The pressure is called portal hypertension. Mid pressure causing the veins and the arteries stretch, et puis you pété, et puis you n'en vomissant. From here all the way to the wall, and that is called esophageal varices. Okay? Now, when you have liver cirrhosis, the patient has ascites, that's stomach. Look at Ricky's stomach, big. Okay? Bleeding, esophageal varices. coagulation problem. Because the liver has to do with A, D, E, and K help with what? Clotting. Now, coagulation, vitamin K. Now, here it is. The liver break protein. Protein is chicken, fish, gros manger. Anytime I eat protein, the liver job is to break it, send it to the blood. Now the liver no good. So I eat a big chicken, my liver no good. The liver cannot break it. That protein turn into what we call ammonia. And prend Ricky not that. That is why once you have liver failure, we find you on Jog Road because the liver cannot bring the protein. And that is why anytime you have liver failure, liver cirrhosis, you cannot eat food high in protein. Now, another name for the loop, encephalacty. That means kukuluku. Now, we have to give you a drug to descend the ammonia. So let's go to the drug. Let's go to the drug. The drug is on page 616. You with me? Too bad. Too bad. And let me tell you something. When you do endocrine, you do eye and ear, you do GI, you set an appointment with Miss Carrie and say, let me take my mama and papa on endocrine, eye and ear, GI, and immune. Nice. You go take your mama and papa. You don't take those in here. You schedule. Because anytime you want these type of mama papa, that means you made date, we ready to go. Okay? Now, lactulose is 616 box 47-8. I'm on number 8. Everybody see it. 616 47-8. 616. Okay, ready? We do not give lactulose for liver cirrhosis. Student, always think that's what Miss Sonia say. We give lactulose to reduce the ammonia that the protein causes. Because you don't only give lactulose to liver people, parce que ou ben lactulose AIDS patient, monkey AIDS chemo patient, a lot of people take lactulose. So I don't want you, Miss Sonia said, you only give liver cirrhosis. That's not what I said. You give lactulose for patients who cannot break down the protein turned into ammonia, the ammonia took them in their head. A lot of disease that happens. AIDS is one of them. Last stage of AIDS. Okay? Ready? Lactulose reduces ammonia level. 2, improve protein tolerance. 3, here go the NCLEX question, baby. It is only given in syrup or rectally. Now that's rectally. Like ubali for jiwabeyo and enema. NCLEX-PN do. I'ma say it in English. Proposition patient pour mettre enema rectal. Remember, you're gonna do it sieves. Yes. You don't do it lithotomy. Lactulose is only given syrup or it's given rectally. And let me explain something to you why it's not in pills. You remember Miss Sonia told you liver metabolize drugs. So if your liver no good, I give you pills. Who gonna break it?
Yeah.
That's why they give it to them syrup or rectally, suppository. And Sims or lethal chest, never lithotomy. Listen, lithotomy is up pushing a baby. If you put something in my rear, lithotomy is gonna come out. You're supposed to put them side, left, lateral, knee to chest, same position. So lactulose is given for what?
To reduce ammonia.
To reduce ammonia. Liver cirrhosis people have what?
Build up the
Higher
They
ammonia.
build
ammonia.
up ammonia because the liver cannot what?
Break down.
No more? Okay. Now pardon on neomycin. Neomycin is the same drug as lactulose. Okay? Same drug. Reduce ammonia. But neomycin, if you have kidney problem, you see, now remember, liver cirrhosis people have what? Liver and kidney. Let's go read neomycin. Let's take a trip. Neomycin reduces the number of colonic bacteria that normally convert urea and amino acid into ammonia. It is administered orally or NG2. It is used with caution in clients with kidney impairment. So class, if I have liver cirrhosis, are the doctor going to give me lactulose or neomycin?
Lactulose.
Why?
Because it just says that it reduces the caution.
The neomycin gonna mess up the
Kidney more.
But the problem with the students, Nclex, not gonna tell you when you have liver cirrhosis, you also have kidney problem. Miss Sonia told you that, because that's a trick. You got it?
Yeah.
So that's why anytime you see people with liver cirrhosis, you buy your lactulose. Because it's understood when you have liver cirrhosis, kidney onto babo. Anytime you give neomycin, which lab I must check? And liver?
Enzyme.
ALTs, right? LFTs, SGOTs. Any question? Yes.
I think I'm gonna question something because I know someone who went to the doctor for constipation. And they gave her,
Yes, they give. Yes.
That's what she-
Because let me tell you why. I just told you, lactulose is given for several reasons. When you get people who take a lot of opiates, they're constipated. The reason they give them the lactulose, darling, is not lactulose. It's for diarrhea, for constipation. One of the side effects of lactulose is diarrhea. When you give it to me, just like K-Exolate. You see, when you give me K-Exolate for high potassium, how you know the drug working? Because bone drug, diarrhea everywhere. Lactulose, automatically diarrhea. The drug is not for constipation. The side effect. That's why they give it.
Most people in the nursing home use lactulose.
Big time. Like Carafate, Cytotec, ICA. Cytotec, in third world country, you call it abortion pill, right? It's not. It's a drug, it's a coder, it's for peptic ulcer, but one of the adverse effect is abortion. So a lot of people in third world country use it for abortion. But remember, anytime you abort baby, you have miscarriage. Go nettoyer.
Have to
There's a
clean.
clean up we must do after you take the cytotec. So a lot of young ladies in third world country will take cytotec, but then they don't go get
You will
clean.
have infertility.
Yes, so cytotec is not for abortion. Just like lactulose is not for diarrhea. It's to reduce ammonia, one of the side effects. Alright?
As a doctor, do you have also where you get the
Yes, and let me tell you something. Women, women in childbearing years, meaning you come to me, you 30-something, as the physician, I will never give you cytotec. Am I crazy? I will give your blood carafate. Garçon, ma balle cytotec.
What do you make men?
Nothing. Septic y couvre ma langue là. We to coder, we won't talk about that. Because cytotec not only make you abort, your chances of getting pregnant is. That's what my mom asked me. Oh, est-ce qu'on connaît côté cash? Cytotec vieille van Haïti. Oh, she go, cytotec is big money in Haiti. My mom told me, she said, demoiselle Haïti, au moins des cytotec. It's an abortion. Right? It will cause you miscarriage. Right? Liver, ALTs, LFTs, SGOTs, OT. Okay? And box 47-9, that is your pancreatic enzyme. Pancreas. You see the pancreas? Everybody will like, where's the pancreas? Maybe. So I taught you, you give pancreatis in 2 diseases so far. Give me the disease.
Cystic fibrosis.
Cystic fibrosis and what?
Pancreas.
You give it with every meal, every step. Remember yesterday in peds respiratory, we did cystic fibrosis. It destroyed 3 organs: reproduction, GI, and lung. See? Guys, you gotta know the stuff. It's getting a little organized. I see some eyes are opening now. Like, it's not so hard. Okay?
You read.
Any question? Now let's go back to our disease. Our disease. Okay? We going back to Ricky. Ricky. 601. Okay, 600. All right? Now stay with me. We said number 7, Ricky will have hepatorenal syndrome because we said the liver make what? Don't work.
The kidney.
The kidney. Make sure you highlight that. Okay? Now, okay. Intervention. Elevate the head of the bed because Ricky will be shortness of breath. Why? Why will Ricky will be shortness of breath?
Because of the hypertension.
Yet because of the hypertension, but the big stomach too. That is ascites.
Ascites.
Okay? Ascites. That is ventre. Ricky got big stomach. Now, provide vitamins A, C, K, folic acid, and thiamine. Why the thiamine?
Nutrition.
Yes, if he was a drinker.
Alcohol.
Okay? Restrict sodium. Why? Because he's retaining. Initiate enteral feedings. Or let me explain something. You see food? Because Ricky won't have energy to eat, they're gonna give Ricky TPN. So class, fundamental nutrition, Ricky is on TPN. What are the 5 complications I'm gonna watch him for? Air embolism, high sugar, acetylene, hypervolume, low sugar, what else? Pneumonia. Excellent. Good job. I'm proud of y'all. Good. Now, number 6, diuretics. Remember, look at his stomach so big. Not is only his stomach, got a pied Ricky. Look at his ankles, swollen. Now, let me explain something to you. They will give Ricky diuretic, but not Lasix. Your book say Lasix, but I'm going to tell you why the doctors, Lasix is not a good drug of choice. Why? Because Ricky already got potassium. So you go give him Lasix. So they will give him what? The clomicin. There's the clomicin. That is the baby Lasix. Now, will we weigh him? Yes. Will we measure his abdominal? Okay. There's something Ricky will do. You say, Ricky, go write your name on the board. Sonia. So that's a Ricky name, R. Ricky will put. Why? Because his hand will flap. That is called estroritis. His hand will flap. 10. Number 10. Good man. So he will not write good. Ricky breath. Bamzinu. Creole. Ricky gon sent on the English. You know when somebody eat onions, you can smell the patient's mouth. That is called halitosis. Halitosis means stank breath. You ate onion. I can smell it. Okay. Factor hepaticus mean muna ande dying, something ande dying. He's sick, AIDS, cancer. He's sick from the inside. That is poop with sugar. Isolated. He ain't gonna make it. Factor. Okay, that's it. Big time. Right? This is what we call factor hepaticus. Steak breath. Okay, musty breath with sugar. Okay, you remember the bleeding he did? You remember he had that bleeding? That bleeding is called esophageal varices. Go to number 12. They will put a balloon temperament who signed that thing. Remember I told you the bleeding? All right. Now go to number 14. We're going to administer vitamin K. Class, I taught you this fundamental nutrition. What's that vitamin K called? Clotting factor, right? Well, I should have changed the English. It's vitamin B12. Vitamin B12. What is it called? Cyanocobalamin. LPN, you should have known that. LPN gives cyanocobalamin. Vitamin B12. Yes. Okay. Now, then we're going to administer blood. Hey, do you see why he's getting blood? Because
of the bleeding.
He gets blood. Right? I'm going to ask you, you tell me why. You see why he's going to get lactulose, right? Okay. Why, or neomycin. Okay, class. Why would he get flagell? Infection. Avoid opiates. Why?
Bleeding.
Because Miss Sonia said,
Some opiates.
anytime you got GI problem, you wanna what? Avoid morphine, special morphine. Instruct the client by restriction, not cut back the alcohol. And that's an NCLEX question. Which one would you question when the patient say, I used to drink 5 beers, now I'm down to 1. No, he can't drink at all. Now, we're going to do a paracentesis. Hey, listen, they can remove the water a couple of ways. Lasix is not good. Some doctor will use it, but Lasix is not good because it causes the potassium problem. Paracentesis, which we will do the diagnostic test. Paracentesis en créole, c'est tirer de l'eau dans le ventre. Paracentesis, remove the water. So again, we can remove the water with baby Lasix, declomycin. We can remove the water, paracentesis. Lasix, yes, although a doctor may give it, it's not the best. All right? It's not the best because Lasix causes potassium problem. And the man already got too much problem. Now, let's go to Ricky. You see everything I read on this page? If you go to Ricky, all the things around Ricky. So, neuro problem, flapping of the hand called asteritis, paresthesis of the feet, peripheral nerve degeneration, encephalopathy, GI, stomach pain, anorexia, clay-colored stools, diarrhea. The disease caused Ricky to have diarrhea. When they give him the lactulose, he gonna get diarrhea. You must isolate Ricky. Someone do my la diarrhea son côté. Diarrhea everywhere. Ricky needs to be isolated. GI problem. Vector hepaticus, the stinky breath. Malnutrition, vomiting. Kidney, you see where it says renal? Hepatorenal syndrome. The liver, hepto means liver, renal. The liver causes renal problem. Ricky didn't have a kidney problem. Ricky had a liver problem. But because the liver no good, the kidney no good. So you will check BUN and creatinine and check his urine because his PP may be frothy. Endocrine, gadetete, Ricky, gynecomastia, big boobs. Okay, now listen. You remember yesterday I taught you when you have too much steroids, what that disease calls?
SID.
Medea. Don't Ricky look like Medea? He enflé. Because when you have liver problem, your endocrine part, your steroids, glucocorticoids, then the corticoids increase. So Ricky looked like a Medea. So that means he's high infection, high in bleeding, and it's true, look at his little skin. So you must isolate Ricky. Immune, everything Ricky low, so you isolate Ricky. Dress like you going to the moon. Cardio, Ricky will have cardiac dysrhythmia, fatigue, peripheral edema. So peripheral edema, you see all that water on his, look how swollen his ankle. Portal hypertension, spidial angiomas, look at his stomach. You see the little lines? Look like stretch marks. Spider angiomas, stretch mark. Pulmonary dyspnea, shortness of breath, crackles because he have a lot of water in his tummy. So that means when you listen to his lungs, on the kisa, low, right? bleeding, anemia, DIC. Where did I teach you DIC?
OB.
Clap, 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 clap. Bleed.
Complication.
This man got a lot of problems. Skin, gluten, Paracentesis mean itching, jaundice, ecchymotic, spider angioma, got a ventlan, what's he doing, you know, ventlan? Spider, look like spider web. Fluid and electrolytes, ascites, right? Go down. Hypokalemia. So tell me what assessment I will do. Low calcium. Whoa. Low calcium. Whoa. Low calcium. Low calcium. Positive Trousseau. Positive Cholecystitis. You don't know the stuff. Ooh. Give me the EKG for him. Look at the potassium. Low, tall B, flat T, U waves. You got down with electrolyte question on Ricky. I asked you low calcium. Right there, positive Trousseau, positive Cholecystitis. Don't forget what you learned. Guys, I need you to take fundamental and stick with the disease. We need to put the icing on the cake. I teach you the pieces of the bonbon, Professor. I get the pan, I put oil, I mix it. Now I want to put the frosting on the cake. It's like making a bed. You put the bottom. You put the top. Now we put the beautiful pillows. We need to mix it. Welcome to nursing. Any question with liver cirrhosis? Any question with pancreatis? Cholecystitis? Hep A, B, and C. All right. Then we go into appendicitis. Appendicitis. Right? Appendicitis. I'm on page 599. Remember, GI take 2 weeks. It's a big section. Appendicitis, inflammation of the appendix. Where is the appendix located? Right lower quadrant. Data collection, pain. The pain in the periumbilical area, belly button, descends to the right lower quadrant. The pain most intense, it is called McBurney's point. Rebound tenderness. So look, when you have appendicitis, come here, Francis. Not Franklin. Franklin's studying. Every time Franklin, you know Franklin come and take his test, I gotta put everybody out the building. If a student go to the bathroom next door, Franklin yell. He can't concentrate taking his mama papa. Every time he take his mama papa, I gotta close the school. He don't want nobody talking. You know Franklin. How long did he study? He came here, a student was talking. Franklin said, get out, get out. But anyways, when you have appendicitis, the pain is here. How you know it's appendicitis is when I push this side. So I go, he go, I push, the pain is here. I push here, he go. That is called rebound tenderness. The pain is here. You never touch, no, right. So let me come here.
Okay.
Do that lot. Okay, he's gonna do this. Guard. Because it hurts so bad. Now, what the nurse gonna do to see is pancreatitis, because if I do this, it's gallbladder. Remember, if the pain is here, pancreatitis. Now he's saying, I have pain. So the nurse gonna come and do an assessment. She's gonna push on this side, and his whole body gonna jump this side. That is called rebound tenderness. And that tells you that is appendicitis. So as an ER nurse, you must know what assessment to do with all disease. Now listen, you're the first one to see the patient. Remember, you're not allowed to diagnose, but you can have an idea by understanding the system. When the patient say, I have a pain here, and the assessment you do, you have an idea that's what the patient has. You got it, guys? So that's why you got, see, when you were as an ER nurse, you're a mini doctor. Because you're the highest level nurse, and you must know what the patient, have an idea. You see that? What's wrong with the patient? All right? So let's go. Pain, told you where that was. The stomach pain is called McBurney's point, right? So McBurney's point is for appendicitis. Cullen sign, Turner sign is for what? Pancreatis. Murphy sign is for what? Gallbladder.
For lymphocytes.
Yo, pas changer. Right? Now, when you have this, the fever not high. Now, you remember pancreatitis, how is the fever? High. See, here the fever will be low. So the only thing the patient will say, I got pain. You're going to do that vitals, temperature going to be bad. You see, so that right there tell you to exclude pancreatitis. Right? And don't ask him do he drink yet, but he can cuss you out. Hold on. Right? Now, elevated white blood cell count, yes. When they do a blood test, they're going to see your WBC high. But when I check your vitals, your temp will be low. You got it? When they do blood work, WBC will be high, but when I check your vital, the temperature will be low. Something is wrong, it doesn't correlate, because when WBC is up, your temperature should be up. So right there, that tells the nurse, okay. You got it, guys? Now, anorexia, nausea, and vomiting. Remember that? They vomit from everything. So the first thing I'm going to do is isolate him because of the what? Okay? Lying and side lying. Position with abdomen guarding. Remember I told you he will come to the ER just like this. Right there, there's a sign that tells me it's the appendix. Okay? Who you see a lot with appendicitis?
African American.
Diverticulitis, African because of our size. Hump, lump. Yes, curvy. Got a lot trunk in the drum. That's why. You see? Huh? What causes it? Grease. Cholesterol. A lot of you have it from eating poorly. You're not eating good, anything. Yes. Yes. Us. That's the system. Yeah, some Spanish. You see it in Spanish. You see it in Spanish. Yes, because he eats a lot of it's the food. Now, what they do, they will do appendectomy. So, Nclex asks you, pre-op, post-op question. Pre-op and PO, IV fluid, monitor changes in level of pain. Guys, listen. Here's the NCLEX question. This thing is so painful. When you have it, so painful. Soon as you tell me I don't have pain no more, it's ruptured. You can die of sepsis. Wow. Anytime the doctor diagnoses you with appendicitis, I want to hear you say, God damn it, I'm in pain. I'm in pain. Hair, pain, pain, pain. As soon as you say, I feel good.
That's why you cannot give them medication.
That's why you cannot give them medication. You don't give them morphine. Well, comprendre? Every school taught this, but they really didn't break it down. That is why. Because the pain masks if it rupture. You got it? Who do not understand? Yes, Lena.
Why would the surgeon, when he do the gallbladder surgery, go ahead on and take the appendix out too?
Because statistics shows once you have gallbladder or appendicitis, you will eventually have either. If you had the gallbladder, you eventually will have appendicitis because they all correlate to fat. So he'll try to do once, all at once, so he don't go back in. Yes, because all of it correlates with fat. And when they take the gallbladder, even if you had a little appendix, a little inflamed, they can rupture it and they remove it. That is why. So, and another, they don't want to go and cut you twice. Dead, sepsis. Huh? You don't need appendix, you don't need the gallbladder, but you don't need the gallbladder anymore. Yeah, but you don't want to give your stuff away. Right? Okay, so let's go. Position the client right side, a low semi-collar. This is pre-surgery. Monitor bowel sound. Avoid heat to the stomach. You can put ice, 20 minutes on, 20 minutes off. Administer antibiotics. Avoid laxative and enema. Why? Remember, this before surgery. If you give me laxative, it will cause it to rupture. Yes. You don't want to give the patient nothing. Post-op, after surgery, monitor my temperature. Why? A, the disease, how's my temperature?
Low.
Low. So if you see my temperature high, no, after infection. Let me say that. Let me say something so y'all can get it good. Pre-op, I still have my appendix. My temp should be low. Pre-op, you see my temperature is high, eruption. After surgery, you see my temperature high, infection. Est-ce qu'ils vont comprendre ça? Ben, ils l'ont compris. Pre-op, I got my appendix. Your goal is to prevent rupture. With the disease, my temperature should be low, right? Now, low. So listen, I have my appendix. My temperature, instead of being low, it's high. 99.9, it ruptured. Not only my temperature will be high, I will tell you I have no pain. It ruptured. You can die because of sepsis, infection in the blood, or peritonitis. After the surgery, your temperature should drop because they remove it. If you still have high temperature, infection due to surgery, which is a medical what? Emergency. Yes.
You said after the operation, the temperature should be normal.
Yes.
So if it's not a high temperature, so
That's a medical emergency.
that's a medical
Because it's It's a complication of surgery.
But the pancreas,
Guys, come on.
it's already removed.
It's a remove. So it's removed. When your temperature passing en haut, ça c'est son complication of surgery. Parce que dans ta sortie.
It's because it's breast or like something
No,
like
baby.
that.
I'm explaining it. Okay. Advanced diet gradually if the rupture of the appendix occurred before. So if before surgery the appendix ruptured, so now the doctor go do surgery, they will put a Jackson Pratt. Yes. If it ruptured, like for example, you have the appendicitis, it ruptured. We're gonna go do appendectomy. They will always put Jackson Pratt.
That's the one
Penrose. Jackson Pratt is to collect the drainage. Penrose, Jackson Pratt, Hemovac, same thing. Because they're checking the drainage. Position the client right side laying, yes, after the surgery. Change the dressing as prescribed. Record the type of drainage. Perform wound irrigation. Anytime you get an appendectomy, the patient will always have an NG tube. Nommage, lavage, and to prevent peritonitis. And also administer antibiotics. Any questions?
Penrose drain to collect the drainage, right?
The Penrose, or Jackson Pratt, or Hemovac. If they say Jackson Pratt, say Membagaila. If they say Penrose, same thing. If they say Hemovac, same thing, collect the drainage. What you had, Hemovac, which we learned in fundamental pre-op page 192, the little things to collect the tube. You know I did because I know this stuff. Not because they want to see. They made the purpose of the Penrose to see, to prevent sepsis. Because it would burst here. Any question? All right, take a break. Go.